5-year-old girl.
Yes, doctor. Yeah.
Sarah is a 4-year-old girl referred to you for the developmental assessment. Please kindly take relevant history from her father Ahmad, and your task is to assess her fine motor skills. And then I'll be sharing the picture on the group.
Okay, Dr. Amit. Yeah.
So 4 minutes for you from now, okay? I will share the picture, okay?
Okay.
Okay, you can start now.
Okay. Good evening.
Good evening.
I'm Dr. Sridevi, one of the child doctor here. I believe I'm talking to Mr. Ahmed, father of Sarah.
Yeah, it's me, doctor.
Yeah, nice to meet you and thank you for coming here. So today I'm here to take details about Sarah and make a note of it, and then I will examine. Is it okay with you?
Yeah, it's fine, doctor.
Okay, so may I know what is your main concern about Sarah's development?
Yeah, I'm worried about Sarah, doctor. She's not developing as well as compared to the other kids of her age, and that's the biggest worry for me, doctor.
Okay, so have you noticed this since how many days you have noticed?
Yeah, this has come to notice like since the CC started, it was long back.
Okay, so is it like initially she was doing and now she is not able to anything happen like this?
No, not like that, doctor. She has been slow since the birth, I should say.
Okay, fine. So can you tell me like what all things she can do now in her like running, walking like this?
Yeah, she can walk.
She can walk. What about running? Can she run?
Yes, she started running just recently.
Okay, can she jump?
She can't jump, doctor.
Okay. And any issues you have noticed in her vision and hearing?
Yeah, she can see well and she can hear well. There is no problem.
Okay, that's good. Okay, so anything else you want to tell about her development?
Yeah, I really can't figure out exactly what to tell, what not to tell, because
Okay, so
it seems like she is generally like slow. Okay,
mm-hmm,
as I
okay,
mentioned, you she's not as equal to 4-year-old kids should be. So
mm-hmm.
I'm quite worried. What exactly you want to tell, ask? Then I can answer it
Okay,
together.
okay, no problem. Can you tell me about her speech? Like how many words, sentences she can make now?
Yeah, she can. Recently, she has started stringing the two words together and making a sentence.
Okay, that's great.
And
If
in
you
terms of
ask,
Mhm.
yes.
Yeah, in terms of words, she can talk around like several words, maybe around 20 to 30 words.
Okay, okay, okay. And if you ask to like no sing a rhyme, anything she can do?
She dances with that song that is played in the YouTube or the televisions, but she cannot sing a rhyme.
Okay, whether she is toiletry?
Oh no, doctor, she is still on nappy.
Okay, she like indicates her toilet needs.
Yeah, like once she wet her diaper, then only keeps she gets irritated and crying, and then we know that the diaper is wet, and then we change it.
Okay, what about her feeding? Can she eat with a spoon?
She's she can't exactly use the spoon, but she can feed with her like finger food. She can manage to pick up and put it in the mouth.
Okay, and she can drink with the cup?
Yeah, she can do that.
Okay, in her dressing, like How she can take out her socks like this? Anything you have noticed?
Yeah, she can take out.
Okay, she helps in dressing and undressing.
Yes, but she's a very beautiful girl, and then she helps in that. She puts her arm out, and then when we dress her.
Okay, okay, okay. What about her play? Like how she plays?
Mm, yeah, she plays with her toys.
Okay, like interact with other children, or she plays alone.
Mm, right at this moment, it's been like we are away from the other families. Actually, we have not taken her away.
Okay.
We have the child at home,
Mm-hmm.
um, uh, and then he has the problem as well. They
Okay.
hardly mingle with each other, but she gets along
Okay.
with the other people, whoever visits on the house.
Mm-hmm. Okay. Okay. So for these things, she has been under follow-up with any doctors. Any test has been done.
For this purpose, not yet, and that was the concern that I have raised to the doctor, whom I have been visiting quite frequently. And he said that
Oh,
you need to undergo this assessment by a doctor, so he has referred to us.
okay. So can you tell me more about the birth? Like when like her mother was carrying, she had any problem during that time?
Mm, no, no, not at all. It was very smooth.
Scans. Okay, scan was normal.
Yeah,
All the
scan was
scans.
done. It was
She
fine.
had any fever or any rashes or any diabetes or hypertension?
No, oh,
No. Oh,
she's fine. She was fine
okay.
at this
Okay.
Minutes,
Not
point.
on
four
any
minutes
medication.
left.
Okay.
Four
Okay. What
minutes
about her
left.
birth? Whether she, yeah, yes, yes. So whether she's like on time or before she delivered.
She was born on time, and then her weight was fine. There was no problem after the birth, and then we were discharged on the same day, and then they did
Okay,
the
good.
test as well, all the hearing and then the eye test they did.
Okay. Was it normal?
Yeah, it was normal, doctor.
Okay. So in these 4 years, anytime she had any other chronic illness or any admissions, any surgery, any trauma?
Yeah, doctor, she had this heart problem, and then
Mm-hmm.
she underwent the heart surgery at around 6 months. That was a very difficult time for us, and then but she made it. We're very lucky in that.
Okay. Okay. So, okay, good. So you are following with the this cardiologist till now?
Yeah, he's very
Okay.
good doctor. He has been helping
Anytime,
the journey.
okay. Anytime she had at birth, they like no after birth, anything they told like very high calcium in this in the child.
Yeah, the doctors were quite worried about it, and then it was normal that time.
Okay. Okay. Can you tell me how many children you have?
Yeah, I have a 6-year-old boy,
Mm-hmm.
and then she's
Okay.
the boy. Sorry,
Okay. So other child is fine.
not fine, doctor. The child has autism, and we have been constantly following with the doctor, and then it's very difficult for us to handle the child.
Okay. Okay. So sorry to know that. So for this, anything like both the children have some problem, any genetic studies were done or have you followed with a genetist?
No, doctor.
Okay. So you and your wife are your like blood relatives?
No, we're not.
Okay. So how are you coping with this illness, Mr. Ahmed?
Yeah,
You and your family?
yeah. The thing is that we have two kids. We have been always coming in and out in the hospitals, always making appointments for both of the kids. It's been really making our life a bit very difficult. It's not easy task, doctor.
Yes, I can understand that really difficult. Yeah. So do you have any financial issues, Mr. Ahmed?
Yes, doctor. I lost my job during this corona pandemic, and then I applied for the social assistant from the government as well. And then my wife is working very hard. She has a
Mm-hmm.
job in the local stores, and she has been doing her best to make the family cope with these conditions, doctor.
Okay, so when both of you when you go for work, who takes care of children?
Yeah, my mother is there, and then she has been helping us.
Okay, so any support group, anything you have joined?
Yeah, with the for my previous child, I have been linked with the autism's like a social network and then local support group.
Okay,
For her, till
okay.
now, I have we have not been able to signpost her with any other association. I mean, like the local group.
Hmm. Like your other child has this problem. Any other family members also had similar problem?
No, doctor, all are fine and healthy.
Okay, so Mr. Ahmed, anything you want to tell me, which I haven't asked till now about Sarah?
Yeah, but I think I must have told you everything. No, the thing is that I'm on audit, right? How I can improve her, and then how the things will be easy for Shara as well, and for us. That is the only worry that I have now.
Yeah, yeah. So after, yeah,
I'm
after
finished.
examining,
I'm
okay,
finished for history. Okay,
okay. So
continue.
I'll present. Yeah. So today I took history about Sarah from Father Ahmed. She's 4-year-old girl. The chief complaint is there is developmental delay for the child, and which is noticed from the beginning. She is delayed in all her activities, and there is also in the development there is no vision or hearing problem. In the grossment, the child can walk and run, can't jump, and also there is in the social also it is delayed because of there is only child can feed with the cup, cannot use the spoon, and uh, and also there is not toilet trained, only she can indicate, and also she helps in dressing and undressing. There is speech delay, only 2 word sentences she can speak, total words of 20 to 30, and yeah, this is about the development. And in birth history, antenatal history and birth history is insignificant. In the family history, there is significant history of family in which the elder brother is having autism, and he's following with the team for that. And also they have social problem. In like very worried about because both of the children are having problems. Yeah. So this is the history. So from these, this child has most probably global developmental delay, and uh, I would like to assess the fine motor examination.
Okay, doctor, please go ahead.
Okay, so first of all, I will do hand hygiene, go observe her and try to make rapport with her. Is she communicating with me?
Yeah, she's smiling at you.
Okay. So when I say hi, Sarah, she is not responding, just smiling.
Yeah.
Okay. Then I will just look for her growth, weight and height. So is she look short or normal?
She looks short for her age.
Okay. And weight, she
Yeah, she
looks okay from the picture. Yeah, okay.
yeah, she
And
looks well.
dysmorphic features, okay,
Mhm.
I can see some dysmorphic features on her face. And then I will see any special surrounding, anything I can see. And then I will proceed for fine motor examination. I will sit at the level of Sarah, and one by one I will give the tools. So first I will give the cubes and make a tower and show whether she can do the any tower, and if she's doing how many blocks she's using cubes.
Okay. Yeah, she's quite not interested in it. She's walking around in the in the in the table. I mean,
Okay,
on the floor.
okay, okay. So I will just call her. Sarah, would you like to play with me? So is she? What she is responding? She's ready to play. Otherwise, I will take help from the mother.
Okay. Now mother helps Sarah
Oh,
to settle
oh,
down, and then she
okay.
started. Yeah, she started picking up the cubes.
Okay, so can she make tower?
Yeah, say like after demonstrating, she can make a tower.
How many cubes she is using?
In the tower, she like it's four towers, four cubes in the tower.
Okay, 4 cubes.
Mm-hmm.
Okay, so then I will tell her to make. Okay, then I will just ask her. Can you tell the color of? Can she tell any color
Yeah, she can
of
tell.
the cube?
Yep.
How many colors she's telling?
Yeah, which one you are showing?
Like a red and blue blocks are there, so I will show her. So can she
Oh,
understand about the color?
yeah, when you pick the red color, she says red.
Okay, then I will give her paper and pen and tell her I will do some straight lines and tell her to do. So what she is able to do.
She's not interested on that.
Okay, so then again I will tell the mother to help. So whether she is doing any scribbling or anything.
She's still playing with the blocks, cubes.
Okay, so I will remove the blocks and keep and then give the paper and this thing. So is she now doing?
Yeah, what do you want her to do now?
I will tell her to make a straight line and horizontal line. So what she is doing?
So she's scribbling on the paper.
Okay, is it like horizontal and vertical scribbling or also circular?
Yes, it's a vertical. It's she's scribbling, and then she can make a
Mm-hmm.
vertical line as well.
Okay, so while doing this, I will check how is her grip.
Okay, then she's having a grip, uh, like a digital grip.
Okay, digital grip. Okay, then I will remove all these crayons and I will give her the cutting scissor. Can she hold?
Yeah, she can hold.
Okay, is she able to cut it?
No, she can't.
Okay, then I will remove this, all these things and give the book and I will see whether she is turning each paper or together she is turning the papers.
And she's very happy and excited to see the book. And then she's
So
browsing through
yeah,
the book and turning the pages.
uh-huh. One by one or all together, like two, three together.
Yeah, she's doing one by one.
Okay, then I'll remove that and give her the beads. So and tell her to thread it. Is she able to do?
She's picking up the bead and putting on the mouth.
Okay, so I'll just take it out and keep under the table and give her the blocks, simple blocks. So how many blocks she can put in the board game?
Ah, okay. Yeah, she can like put the two objects on the board.
Mm-hmm. Okay, so in order to complete my examination, I would like to complete with complete other developmental domains. I would like to examine. Also, I would like to examine complete neurological and head-to-toe examination for this child, including cardiovascular examination.
Okay, doctor. Can you tell me what is the summary of your fine motor assessment for Sarah?
Yeah, today I examined Sarah. She is well looking, a very happy child, and she's short for her age, well grown. And I can see some dysmorphic features in the form of depressed nasal bridge, bulbous nose. There is long philtrum. There is full cheeks, and there is large mouth and thick lips and low set ear. With these findings, I would also like to check the iris if she has stellate iris. So maybe it's a case of Williams syndrome. Today she was able to make tower of four 4 to 5 cubes. She was able to demonstrate some scribbling, but she was and also vertical line, but she was not able to do the horizontal line. She also has she was not able to cut with the seizure. She was not able to read. She was able to turn the pages of the book individually, and she can make the board games, simple board games. She was able to put two at a time. So with these findings, I will put the developmental age of Sarah in fine motor as around 1 to 1.5 years,
1 2.
or yeah, around like 1 to 1.5 years.
Okay.
Or
So what made you think that this child is not having the fine motor development above the 1.5 year?
she is making only towers like 1 year. She is not able to make with the 6 cubes. She can make only 4. Okay.
Mm-hmm.
And she can do the scribblings only, not the circular scribbling, this horizontal and vertical scribblings, which is around 1.5 years they do. And yeah, and turning pages individually also at a, so that can be actually a,
Okay. So how would you manage this child?
this child needs, first of all, I'll take complete history and involve the consultant. And for investigations, confirmation needs genetic study, and then complete developmental assessment of this child. And in the management, needs multidisciplinary team involvement, including the community pediatrician, the developmental team, including like the speech therapist, then physiotherapist, occupational therapist, and also maybe because of the underlying illness of a genetist to be followed up, then cardiologist, and social worker, uh, and financial support, educational healthcare plan for this child as she's going to be 4 years now, and psychological support for the family.
Great. How would social worker help in this situation?
Yeah, social worker one is may help them in taking care of the children, respect care they can provide. Also, they can arrange for the financial support.
Okay. What are the causes of global developmental delay?
For this child, it is maybe because of the learning problem they can have associated with the Williams syndrome.
Mm-hmm.
Second cause could be because of like underlying illness, like problem, like cardiac illness, what she was having. And
Mm-hmm.
third, also they can have associated hypothyroidism.
Okay. How do you like to investigate child?
Uh, Investigations, like I told, like for a diagnosis, genetic study to be
Okay.
done, and
Except the test.
other than that, because they can have hypercalcemia, so calcium should be done,
Mm-hmm.
and a complete bone profile needed for the child. Also, they are prone for like kidney, kidney stones and all. So maybe X-ray if needed,
Mm-hmm.
and urine test, urea creatinine, complete blood count, thyroid function test. Uh, yeah, these investigations.
Okay, then. How would occupational therapy help this child, Williams syndrome?
Yeah, occupational therapist usually they help in doing the daily activities. So like home changes if anything needed for the support, or in the school, uh, for that they help.
Okay. Time is over now, Dr. Noor.
26 seconds left.
Okay. That's fine, then we can end, I guess.
If you're done, it's okay. You can give the feedback.
Dr. Sridevi, I'd like to hear from you. uh, how
Yeah.
how was the history? How was the assessment? What could have been done better?
Yeah.
Dr. Noor?
Yeah, tell me.
Okay, Dr.
Hello.
Sridhar.
Yes.
Yeah,
Yeah. Yeah.
yeah. Can you give your
Maybe
own feedback?
I don't know. There
Yeah,
is a maybe examination that like no developmental age. Maybe I would have made higher for
yeah.
this child.
Mhm.
Okay, that is what is I can feel, and I don't know. Other you can tell.
I
I
want
think
to
that,
ask one thing. She was doing vertical scribbles, or sometimes she can draw vertical line.
ah, that's quite tricky.
Yeah, she can. As I understand by the way you said, she was scribbling, but also she drew vertical line. This is what I
Yeah,
understand.
yeah.
So horizontal line comes before vertical line. So she can be up to
No,
two.
no. Vertical then comes horizontal.
Yeah, vertical first and then horizontal.
Okay, still you can give for vertical line 2 years, right?
Yeah, vertical line 2 years. Okay, on let's talk about the fine motor assessment first.
Okay.
And in terms of fine motor assessment, you could have access the handedness, one thing.
Yeah.
And then the other thing is that in terms of tower, like when you build a tower, when I say that she could build a tower of 4, then like as we do normally in the clinic, then we'll further make the child to make a tower of higher, I mean like more number of cubes, isn't it? So you could have approach like I would like her to make.
So okay.
Yeah.
So in the exam we can ask like that.
Yeah, I think, isn't it? Like we can push more forward, isn't it? In terms of cube as well, whether she can, now she is making 4. I want to
Yeah.
see like if she could be able to make more than that,
Okay.
isn't it? With the cubes, you could have tried with making a train or even a bridge a
Yes.
bit
Yeah.
further
I
forward.
was thinking, but she was doing only 4, so I thought she we need to go further or not. That's why I didn't go
Yeah,
for.
yeah. Sometimes assuming that, yeah, this is quite tricky. Okay, but with my experience, I think that we need to push a bit
Yeah.
further
Yeah.
ahead.
At least maybe
Yeah,
train or yes.
yeah, at least not to an extent like from there directly going into like I'll try to make her whether she can do like steps of 3 or 4, not like that, a bit higher up, one step ahead, so that we can assess where she is. And the other thing is that I think most of the things you did it correct. Okay, I could have like you you did everything step by steps. And then what I would have done is that I would first tell that I would collect this in like developmental kits, and then I would proceed like that. But you did the fine way, like every time you introduce the new thing, and then I prompted you in between to make the things clear on the table so that she can involve into one activity. And then
Yes.
developmental age for fine motor of this child, I had made it around 18 months to 2 years of age, not more than
Okay.
that. Okay, and then the child that I presented in the history, it's a global developmental delay, and putting all the things together at around 2 years of age.
Okay.
Yep, you finished on time. Developmental history also. I don't think that yeah, for me also, what I have put on my list, you asked everything.
Okay. So examination, maybe more detail. So if they stop, also better to go for the next step.
Yeah,
Right?
better to go for next step.
Yeah.
And,
Yeah. Yes. Yes.
so that I can. Do you agree?
Yes. Yes.
Okay. Any feedback from Dr. No?
Even she was doing, Dr. Amit, she was doing this board also. So I
Mm-hmm.
think this age should not be 1 year or 1.5 years. should be little bit more age for her.
Yeah.
1.5 to 2 years.
Yeah.
Yes, yes. Yeah, board also 2 means 2 years. Yeah.
Yeah,
Board
And
also.
she can recognize two colors, no?
yeah, two colors also.
One color, he told red. Yeah, but that also
Yeah.
okay. Like one color they will recognize by 2 years.
Yes.
I also think below 2 years, the age difference should be between 2 to 3 months. So not 1 to 1.5 years. That's 6 months gap. That's a little bit too much.
Yes.
And also during your examination, good job, Dr. Streets Devi. But during your examination, you should not say the child has dysmorphic features. Go with unusual features, especially if you're in the Western countries. Then the child, you say the child did not do this because maybe the child might be able to do it later on, or maybe the child does it at home. But right in your presence, the child did not do this. So sometimes you have to be conscious of the English we use so that
Yeah.
we don't get disqualified. But overall, you did an excellent job.
Something else, you should offer the pen and paper before the cubes, because usually they will stuck with the cubes and they will play more and they will not give you any interest in the actual life. So start by the pen and paper and crayon, and leave the cubes before the end of the steps of the file. That's only also advice.
Okay, okay.
This doesn't apply in all kids. Some kids actually like pen and paper more than bricks. So she can always start with one of the two. Some they will not release the cubes, some they will not release the pen and paper. So kids differs.
One question from my side: if we should explore further about the other causes of late developmental, or only we should stick to, as we have find that the child is having some dysmorphic features like it's looking like Williams syndrome. So we should stick to that, or should I explore further any reason behind if there is any infection in the past or something like this?
I think she asked the question like, did anything incident happen which was quite significant? I think she tried to explore it, and then from the beginning, I told her that she has been slow since the beginning, long back, and then in between also while taking the history, she asked, and at that time I answered her that she had underwent the surgery.
Oh, okay.
But you are right. We need to ask. Even despite being like a syndromic child, they can have
Yeah,
repeated infections for any
yeah, the same,
reasons, being admitted to
yeah,
hospitals.
yes, definitely. The same thing I was thinking, that even if a Down syndrome or Williams syndrome, which we can recognize easily, but
Yeah,
even though we should ask about the other causes, I as well. Yeah.
yeah. And then in explanation also, she explained what is the causes of developmental delay, and she explained that it could be the organic cause, like she has the heart disease, and then she's not doing well, and that could also have led to the developmental delay.
Okay, I have one comment. This when you said that after scribbling she was doing horizontal line, should we draw a circle and show to her to copy it the next step or no?
Yeah, we can always do that.
Till it ends, because once after scribbling she was able to draw the vertical line, she did not check for the circle. This is what I want to tell.
Yeah, true. In its steps a bit higher up, one step ahead, so that we can try to figure out where exactly the child remains in terms of assessment.
For
Yeah.
this, I think, Dr. Noor, you will have to say that you will not show her to how to draw this circle or something, any shape. You will draw in hidden. You will hide and will draw by yourself, and you can ask, you can draw like this. If the child is not understanding what is the circle or triangle, something like this, but you can draw by yourself, but you will not draw in front of her or him.
No,
You will hide. Yeah.
there is
You
imitation
can hide.
and there is copying, right?
Yeah.
Imitating is you will draw in front of her and she is able to draw. This is imitating.
Yes, this is
Copying is
imitating.
you will draw hiding to her and show her to draw, right?
Oh, yeah, this one I
So
know.
imitating comes before copying.
Yes.
I think I don't know how many months, 3 months or something. I have to check it. Imitating comes before copying.
Yeah,
So
it's coming
after
before copy.
vertical line, if you are going from down to up, you will go for imitating first, then copying. Or you want it, if it will waste your time, you can do like this: hide and draw. First check if she is not able to copy, then you can try imitating.
Yeah. Okay.
That is also fine. But I thought she should have done one more step here. This is what I wanted.
Yeah, she can do that one.
Yeah. Otherwise, it
just
was fine.
Just missed the initial part. Did she ask about the color vision by asking her to match the two cubes? And
Yeah.
did she?
She asked about can she identify the color and what color is this, and she
Because
was able
that
to
comes in language, so that's why the examiner says that rather than assessing the language, tell her to match two colors. This was just one thing. And grasp, she must have asked about the pencil.
No, yeah. She should. Yes, your point was right. She shouldn't ask to show the red color. She should take something of the same color and ask to match it. Right. This is for the vision.
Yeah, this is for the vision.
Dr. Sridevi, how did you ask for the color? Can you tell me again, please? Hello?
Yeah, if she is not there, I'll tell her. Can she tell that? Can she?
Yeah. For the vision, actually, in the station, you will take the same color. Suppose there will be one crayon and there will be cube of red color. You will take the crayon of red color and ask her to give the crayon of same cube of same color like this. You will do matching. You will not ask her what color is this. If she says it becomes
developmental picture that has been given on the RCPC site, there are two cubes of the same color also. Probably there might not be a crayon on a cube of the same color, so we can just pick one cube and tell him, give me another cube of the same color. As per that picture, there are two similar sides.
Yeah, right. Okay. We are done. Anyone has any comments? Okay, if no comments, we will finish the meeting. Thank you so much, Dr. Amit, for the preparation of the case. It's very helpful and good revision for us.
Yeah, thank you for you also.
Inshallah, please do participate as candidate also. I will message you, inshallah.
No problem. This is more tedious job than being a candidate.
Okay, today we will end the meeting because from 7 p.m. we have Dr. Salma's meeting.
Yeah. So let me say one thing. Okay. Finally, like I will also remember this. I will also do the same mistakes while giving the inference of the developmental assessment. We can say that today I examined Sarah, who has the unusual features suggestive of Williams syndrome. In terms of her fine motor assessment, I would put her in the age of 2 years because she could demonstrate today with these things, but she could not demonstrate these things today like this. Rather than explaining what you did and what she didn't do, first developmental assessment. Why? Because she could demonstrate this and she could not demonstrate today this. That's all.
Okay. Okay, any other comments before we end the meeting? Okay, Sridevi is back here. Hello? Yeah.
Yes.
We were asking about how did you ask for the color? Can you say again?
I asked for color like, do you know what is the color of this block like this? I asked.
Yeah, that is what we were discussing. You shouldn't ask like that.
What is this color or some like?
What is if you ask like that, it becomes like expressive speech. If she says red like expressive, you will take a cube or anything of the same color and ask her to give, like take the cube of same color and ask her to give the cube of same color.
Okay.
I hope you got the point.
Yes, yes. Just to know the color vision assessment.
Yeah. That's all. Because asking what color is this becomes expressive speech.
Yeah.
Okay.
Maybe even while presenting, I did not told about all the positive finding. That's why my development lays also was wrong. Right?
Yeah, and also for every presenting we have to practice. Record yourself and practice that. It should come in 1 minute.
Okay. Yeah.
And you have to tell all positive findings. And also you can, when you are giving the age, when you give the age, you should also tell she was able to demonstrate drawing a vertical line but not a circle like this. Today she was able to demonstrate this but not this. She was able to make cubes of make tower of 4 cubes but not 6 cubes like this. The immediate next one you will tell. Okay.
Yeah.
Just I have a small question. What is the ideal answer for what is the cause of this developmental delay? The answer only just because of the syndrome? I mean, what is the ideal answer for this question?
Yeah. One is the genetic, the syndrome itself. Another is they may also be associated with hypothyroidism. Okay. And one more thing, they will have heart problems, cardiac problems. Any patient with chronic problems can also have developmental delay, right?
True.
Do they have hypotonia? I'm not sure. Even that could be acting as a component.
Hypothyroidism, I said.
You said hypothyroidism. Yeah, that is there. Hypothyroidism is there.
Yeah. So one is hypothyroidism. One is the syndrome itself as the genetic cause. Another, they will have cardiac problems. Maybe they will have the cardiac repair and all things. I don't know if Dr. Amit can.
Due to the genetic problem, they are even having learning difficulties. So that itself can also lead to the difficulties in the learning process. That also we can add as a fourth point.
How common is hypothyroidism in these children?
It's given in patient info. Hypothyroidism is there.
Common. It's common. All syndrome can have hypothyroidism.
Okay.
Okay, right.
Because this confused the candidates in exam. Because of hypothyroidism, they were thinking Down syndrome because there was no universal cue in the exam. Only they described the unusual features, the examiner. So, I don't know. So, Dr. Amit, apart from this, you want to add anything for the developmental delay, hypothyroidism, the genetic cause itself, then?
And the last thing is finally the social background, isn't it? The emotional thing, neglect.
Okay.
Even the neglect.
Elder one had autism, but did she had autism? Because you were telling something, I did not concentrate there. Did this child she was playing alone, you said, right?
Yes, she was playing alone because the other child is autism. She can't play with that autistic child. But overall, she was not autistic. That was my history that I had made. Okay. And then.
Yeah, during the presentation, Dr. Sridevi, did you tell about social problems? I think you told financial and
financial problem.
But I don't know about the other child she told or not.
Yeah, I told about other child.
Okay.
Dr. Noor?
Yeah.
Regarding the play, okay, this child, solitary play, this is the age of solitary play. Okay, so the play cannot determine actually in this age. But suppose if this child was 4 year, 5 year, and he is playing alone, then we could say solitary play is not at this age. So play according to the age different, like, you know, solitary play
Yeah,
is
it means
small
he,
child.
delayed in social also, because the chronological age of child was 4 years,
Yeah.
and the developmental age is 1.5 to 2 years.
Mhm.
Someone was telling below 2 years we have to give 3 months gap, right?
Yes, yes. Below
So
2
9
years,
months you can give
Yes.
80, sorry, how much? 18, no,
15 months, 15 months, 1 year to 15 months, or
21 months to 24
21.
months.
Yeah, 21 to 24.
okay.
Because below 2 year, the development is very congested. So it comes very congested age, 3 months. And more than 2 year, the development is, you know, skipping. That means it is a long gap. So you can give a long gap, 6-month gap. But below 2 year, it is less. This was in which year question? Recall. Williams syndrome with development.
Jeddah, this year.
Jeddah, this year. This question came many times. I saw the recall many times. This question came.
Which question?
Yeah. Williams syndrome with development, and they give also the social development. You know, social means play. Special autism with social development. William with social.
I agree with that. Below 2 years, we need to give the 3 months range. Okay, but when it comes to above 18 months, I think fairly you can say from 18 to 24 months, because I have never seen developmental milestones in between 21 months as such. That's my personal experience. Huh? Anyone can comment.
Let's check it and confirm it, or maybe
In the
1 year we
RCPH,
do for 3 months. I am not sure.
no, in the RCPH webinar, okay, last time there was a big webinar, no, 2 hours webinar. That webinar said below 2 years and above 2 years. Easy, okay? Remember, like easy things. Below 2 years, congested development, so 3 months. More than 2 years, wide development, so 6 months.
Okay, if they have told like that, better to go with them. 3 months. If we are giving age below 2 years, let's give the 3 months gap. Above 2 years, 6 months gap. Okay.
Okay, who can tell me that what is
Actually,
the
it is also in the mark, I think. Like below 2 is like 2 to 3 month gap, and the 6 months is 2 to 5.
no? It's given
In the mark
everywhere.
also it is there.
It's
Yeah.
given everywhere, but none of the books has written the developmental milestone of 21 months. That is what I mean.
Yeah, definitely. It's really
That is
difficult
what
to
I
say
like.
like that.
Yeah, who
Yeah.
can 21? That is my personal thing. Okay, so every developmental milestone is always 18 months either or 24 months, not a 21 months. That is what I am saying.
Yeah.
So what's final? What we will tell
So the
if we get
If there are more things which the baby has done of the 24 months zone and just 1 or 2 of the 18-month zone, then we can put like 21 to 20 to 24 months, because more things of 24 and less of very less, just 1 or 2 of 18. Means now we're going to assess 6 parameters, 6 areas. So like just taking, but more of 18 and very less of 24, then we can put 18 to 20 months. That's what I feel. That's the safe place then.
that's also acceptable. Yeah.
Means if there are out of the 4, out of the 6, 4 he does for 18 and just 2 of this, then put him on that left wala scale.
Okay, thank you all. If no comments, I will end the meeting. Okay.
Okay, thank you.
Thank you so much, Dr. Amit, Dr. Sridevi, and
Thank you. Thank you.
gave us the feedbacks. Thank you.
And thank you all for the active participants who all commented and give the good feedbacks.
Thank you so much.